So welcome everyone. This is the webinar on December 15th from 7 to 8:30. That's the fireside chat with Les Greenberg and Rhonda and myself. And Shigeru and Lauren are also on our videos. Shigeru is the current president of SEPI. Rhonda was our first president, and I'm going to be the next president. Lauren is our technical person. So I'm just going to show you a little bit about what we're going to do. So we're going to do, the agenda basically is this. I'm going to first introduce the panel participants. I'm going to show you some slides to do that. And then I'm going to briefly discuss the upcoming meeting that will be held totally online now, as we've been discussing recently. And I'll be the moderator, the interviewer, and a co-participant in this webinar as well. So you don't have to worry about that part. And we hope all of you will ask questions. Our question moderator and technical guru is Lauren Lipner, who you can see there. She's the blonde lady. She's waving her hand right there. She's a postdoc working with Tracy Prout in New York City, and she will act as the contact person and monitor the questions that you might have. So you're going to please direct questions in the Q&A section. You don't have to identify a target, but you can identify a target if you want. So don't address everyone in the chat when you pose a question, because you want to notice that there are two functions that you can all use. One is a chat function and one is a question function. The chat function you would use like anytime you use Zoom, and you pick out a person you want to chat with and go for that. And the second is the question and answer function. That's the one that Lauren will be monitoring with our questions. So go ahead and ask questions, and Lauren will feed them to us every 20 minutes or so. And then at the end, we will do an even more unstructured question session for anyone who wishes. So we wanted this to be a very casual and open discussion. So no problem there if you have lots of particular questions. And also, it would be nice to know what part of the world you're from. So go ahead and put that in the chat if you want. Just put the name of your town or country if that's easier for you. And there are lots of you here. We can see that and comment on it so that you know. So just remember, when you have a question, to address your questions to Lauren. Otherwise, we may not see it and may not answer it. And Lauren will be the one who is also the technical persona. If you want to or have a technical concern, you address Lauren in the chat about that. And she's going to keep us all in the loop so we can answer those questions as we go. Let me see, here we go. So first let's introduce the panel, and the first person we're going to introduce you to is the guru here, the bearded fellow in the middle, who's Dr. Les Greenberg. He's spent most of his academic life championing emotion-focused therapy, but most importantly, he's taken on the mantle of Carl Rogers and Fitz Perls, and I would also say Carl Jung, who was the first emotion-focused therapy in the psychodynamic world. And he's redeemed emotion as an important human process that we must pay attention to. And he's introduced an emotion reaction typology that many practitioners now know about, and he might talk about that today, we'll see. He's a founder not only of EFT, but also of the International Society for Emotion-Focused Therapists, or ISEFT. On the ISEFT website, you can find out where he's training and who are the international trainers that are recognized by ISEFT. And Dr. Greenberg is also called a DRIP at York University, which means he's a distinguished research professor there. That is above emeritus professor, by the way. And therefore, he's done a lot of research, particularly process research. And he's trained many graduate students to do both process and qualitative research. He was formative in using task analysis and model building in psychotherapy research, and he's also a prolific writer. He's one of the very first founding members of SEPI, because he's one of the originals, and he has a daughter and a son and 2 grandchildren as well. He lives in Toronto, and you can see him in his home in Toronto. We're lucky to have him because we were worried about whether he would be here tonight. So Rhonda lives in Chicago. She's presently a professor at the Chicago School of Professional Psychology, and she graduated from York as one of Les's early students when I first started there, and is considered internationally to also be an expert in EFT. In particular, she's an expert in case formulation as well as couples work, and she's done a great deal of research modeling self-soothing as well. So you want to know that. And Dr. Goldman has written extensively with Dr. Greenberg, and she has been involved writing a number of volumes on EFT in general, including the 2004 text on learning emotion-focused therapy and another 2008 text on EFT for couples. And she co-edited that 218 clinical handbook on EFT as well with Les. And she's most recently been involved in co-authoring a deliberate practice text with Dr. Tony Rose-Manier and Dr. Alexander Voss, both of whom are SEPI members, on experiential therapy and empathy, which is going to be published very, very soon in 2021. She's also a founding member of ISEFT organization and is considered a fabulous trainer. She was the first modern president of SEPI, which I've told you before. She's married to a physicist, has 2 sons, and she's lived in Chicago for 20 years. Then there's me. I'm an associate professor at York University, and I've been on there for 12 years as a faculty member. I'm also an ex-student of Dr. Greenberg and also a well-known trainer at EFT and also identified as an international trainer by the ISEFT training site. I've run international trainings in Germany, Hong Kong, and Switzerland, York University as well for graduate students, and I've co-led those with both Dr. Pavio and Dr. Goldman, Rhonda. And I recently have been very interested in integrating EFT with dynamic and DBT approaches to accommodate more emotionally dysregulated clients, like those who have personality disorders, substance abuse issues, or complex depression. And I do a lot of writing on EFT for personality disorders. And I've also recently been training in the general public in a small workshop to increase emotional intelligence in people generally, and involved in explicit psychoed for EFT, which I'm also quite interested in. So I'm going to be the current president of SEPI starting this January. I'm not married, I have no children, but I have 5 nieces and nephews that I love to pieces, and I've lived and practiced in Toronto my entire life. So let's just talk briefly about the SEPI meeting coming up in 2021. We decided that because of all of this COVID uncertainty, I'm going to move you guys around again. Where the hell am I here? I can't see anything. Because of the travel restrictions, whether we're going to be immunized, having a university site in Lausanne that people had to travel to by taxi or train, hotel fares, ageism, etc., that it would be safer for everyone concerned to have the annual conference totally online. And we know this is going to be disappointing for some people, but sort of that's the way it is right now. We're selecting our platform. We're going to try to be as loyal as we can be to times considerations because it will get more complicated because of time issues. But we will be following our normal structure for the most part with 3 pre-conference workshops, 3 invited plenary talks, and we also have Les Greenberg, who's with us today, to do a keynote talk. We also normally invite research mentors whom we talk to, or you can talk to, make appointments with, and often also have 2 poster sessions. All of this is going to be online now. So live virtually, we hope. So in other words, people will be doing this live, but virtually live. So you'll be able to view also any talk on demand later for up to 1 year also if you need to or have to miss a talk for work or another commitment. The prices are obviously going to be reduced, and all of that info will be forthcoming as we solidify our plans, which we haven't done yet. And we're going to keep you posted on any changes as they occur. We already have many submissions, which we do actually have. There were 70 submissions overall. So the theme for the meeting is going to be working with emotion. Duh. That's what we're doing tonight. So people seek treatment because they don't like the way they feel. And we figure that all emotions, all therapies are trying to change people the way they feel. Working with emotion may be the quintessential process for human improvement. We have to know how to do it. There are any number of domains that can reflect a focus on emotion. So we're going to welcome discussions on any of those. Culture, emotion is important. Emotions experienced by people, like at different ages, cultures, etc. Like we had a girl in one of our groups who was from Puerto Rico who said she couldn't be angry because everyone else in her family who were boys could be angry, but she wasn't allowed to be. There was a gender and culture thing happening there. We can talk about emotional well-being, optimal emotional well-being from an integrative perspective to realize that emotion is a very integrative process that deals with a lot of different parts of the human mind and body, going beyond binary thinking, such as good and bad. Some people think, emotion can only be positive or negative. And so we're going to talk about that as well. We're going to talk about emotional diversity, understanding what suffering can be depending on the disorders that you might have, and also how to transform pain, because therapists work to help transform their clients' well-being and try to make them feel better, or at least have some sort of improvement. So that can sometimes seem like magic, but it's not really magic. So we're going to talk more about how it's not so much magic. You can actually learn how to do that. So, and there's lots of methods as well. So let's start. We're going to talk, the deadlines for submissions has been extended from the 14th to the 25th, which is Christmas. So you can find the call for papers at the website, and maybe Lauren can post this stuff there I'll give her the slides and you can post all this stuff. There's also a page, the proposal guidelines, and there's also a link on the bottom of that proposal guideline page to help you submit if you want to. And registration for the conference will be slightly cheaper, and we're going to keep you informed of that. Again, we're working on the conference pricing. We'll get to that to you as soon as possible. So I was super fast, right? So let me stop sharing. And so we can just start talking. There we go. So the first question I'm going to direct towards Les. Basically, I'm going to ask Les how EFT was developed integratively, and also ask him what the core principles of changing emotion or use that EFT uses might be. Take it away, Les.
Thank you. So
we've got Lauren, and just so that you know, Lauren and Shigeru, you will see, because we've been asking for an audience, and so Lauren, Shigeru are our audience.
Well, I started off training as a person-centered therapist, and essentially EFT started, and when I joined SEPI right at the seminal meeting, I was trying to integrate different experiential traditions, and that in and of itself was a major task. So I was integrating client-centered Gestalt, and then we tried an effort, a handbook of experiential psychotherapy, to say client-centered Gestalt, psychodrama, existential as the main core of humanistic, all had some fundamental common principles. But that never succeeded because the schools, all particularly Gestalt and person-centered, sort of wanted to maintain their identities, so even within a similar view of human functioning, it was still hard to get them to agree. So eventually, I started off calling it process experiential psychotherapy in this effort to say that we focus on process and we focus on experience. But over time, it became clear to me that emotion was really central. And so then the integration became really at a level of practice, an integration between client-centered and Gestalt, plus research, and plus affective neuroscience theoretical framework. And then I was also psychodynamically informed, had studied a lot of therapy tapes.
Systemically informed.
Pardon?
And systemically too, didn't you work?
Yes, and then and then systemic. And the systemic part was important because I trained at Palo Alto for a year in an interactional perspective, and then that sort of fed back in both into the development of the couples therapy, but also back into the individual therapy, and particularly the emphasis being on the dialectic between leading and following. And in systemic, leading was more necessary, and I integrated guiding more from systemic and then sort of brought it back in. And then I was reading a lot on, I was an engineer before, which some people may know, and I came into psychology with this notion that we know more than we can say, personal knowledge from Polanyi. And so I was always pursuing that it wasn't our conscious conceptual processing that guided us, but that there was some gut feeling, some kind of emotion. So I was always reading more and more. But when I started off, there were 3 books on emotion, by Magda Arnold, by Tompkins, and by Plutchik.
Lazarus, yeah.
And not Lazarus yet, right?
Oh, not yet, eh?
Those were but there was hardly anything written, and I was just very interested in this thing that I know more than I can say, and that somehow feeling is guiding that. So that's some of the integrative part, right?
So what are the core principles that you can imagine are part of working, how an individual would work with another person emotionally?
Yeah. What was interesting was there were principles of cognitive change, principles of behavioral change, even interactional change, but not principles of emotional change. So I sort of outlined 6 basic principles, but I'm not going to go into them all. But clearly emotion awareness is a basic principle, and then emotional expression is not the same as emotional awareness. But
exactly
what I've really come to as most fundamental is the principle of emotion transformation, which is changing emotion with emotion. that the best way to change an emotion is with another emotion. So that I can't argue you out of or try to rationally change your amygdala-based deep emotional fears and shames and so on. And that the best way to change an emotion is with another emotion. And to just sort of thumbnail sketch that, emotions are fundamentally action tendencies. So the withdrawal action tendencies of fear and shame, I'm going to run away or shrink into the ground. Well, if I can help you to feel anger or sadness, which are approach tendencies, you can't run away and approach at the same time. You can't thrust forward in assertive anger and escape in fear. So the assertive anger changes and undoes the fear, and you get a new kind of blend. And so this is a developmental perspective, not a learning theory perspective. So you don't learn something new, but you actually, different parts of you synthesize and you develop novelty. So I think changing emotion with emotion is really one of the most fundamental, important ideas that wasn't there in the beginning, but I see it as central now.
Rhonda, do you want to add anything to that? Or
well, not so much add, but I mean, I can build on it if you want.
Sure.
That we could do it that way. Do you want to ask me, or do you want me to just talk, or?
Go ahead.
Okay.
What do you think of as the core principles of?
Okay, so this is what I was going to talk about, this changing emotion with emotion, but I think we do that in different ways, right? So like as we've developed EFT over the last 30 years, we have identified that there's actually, I think this core principle of changing emotion with emotion is what we do, but we do it actually in different ways. So I'm going to share slides and I'll just talk from the slides because I'm sharing, but that's not the slide. Those are your slides, right, Alberta?
Oh, sorry. Let me just get rid of this. What am I doing? It says I'm supposed to.
It might be that I am sharing, but
Oh, you're sharing my slides for some reason.
Yeah. Okay, hold on. I'll do it. Okay.
There you go.
There we go. Okay. Okay. So I like talking from slides.
So you want to just go to your.
I'll just talk about, this changing emotion.
Perfect.
So building on what Les was talking about, right? This changing, right? So we actually talk about 3 types of transformational emotional change in EFT. And so, right, so interpersonal, and interactional, right? So if we just take intrapersonal, which I think Les was referring to there when he was talking about changing emotion with emotion. So this is facilitated by therapists to client. And then if we take like an old emotional memory, such as shame, or he was talking about fear, but really what we're doing through the process of the work is accessing the old emotional memory, and then through the process also accessing new emotions, right? So adaptive or assertive anger. And so those come in, and this is the part how we get into the process of transformation, is we're sort of mixing those together, but these are new parts of the self that people are actually accessing through the process of therapy. And we're helping them to actually feel it in the session, which is this lived experience that Les was talking about, so important. But altogether, this leads to a new, successful, positive emotional experience, such as pride, self-confidence. So see how it's really like, I even did the colors red and green to make brown. So it's really not like it's not a matter of replacing an old emotion with a new emotion. It's actually mixing these emotions and getting all together a new emotional experience. So that's the intrapersonal. But then if we look at the interpersonal, it's also changing emotion with emotion, but it's the therapist offering their compassion or their empathy, their soothing to the old emotion, such as shame. And now I'm blending a different emotion. Like let's say we go with soothing or acceptance. So that somehow the soothing acceptance of the therapist is blending with the old emotional memory of shame. And that also produces a new emotional experience of pride, self-confidence. But then if we go to the interactional, right, because I work with couples, and where the EFT is for both individuals and for couples. And I think it's also about changing emotion with emotion, but it's interactional now. So if we just look at a basic couple, a fairly classic cycle this could be, which is secondary blaming anger. Let's say that's what she's expressing with the finger going, and he's feeling primary fear, right? But what we're saying is if he gets to see her heart, right, and her core pain, her core emotions, then that's going to actually melt his heart, right? And this is what we're trying to do with the therapy. So we're trying to create, this is a softening process. It makes it look easy if you do it on a slide. It obviously takes time when you work with this in therapy, but this is a negative interactional cycle being transformed into a positive interactional cycle. So it's also changing emotion with emotion, but this is an interactional, and this is facilitated obviously by the therapist over the course of therapy. So that's like trying to answer that question. And I don't know, Alberta, if you want me to.
Yeah, go ahead. The second question I was going to ask Rhonda was what she looks for when she's actually, or what she's listening for when she's working with the person, emotionally speaking. So
okay.
We've got
so that's the question that I'm going to answer, funnily enough. So so case formulation. So we've written, and this is Les and I have developed over time, the case formulation, the emotion focused approach to case formulation. And just to say that originally when we were approached to do this, we didn't have a theory of case formulation. And our first, I was a graduate student at the time when we started this, and my first response was like, well, we don't do that, right? Because I was also very much raised in the experiential humanistic tradition, which was quite sort of opposed to the notion of diagnosis. And formulation and diagnosis are close cousins. And it involves really sort of thinking in advance. And I was always trained to be very present, very in the moment, and very experiential. And so it was hard for me, and I think for us but we developed our theory of case formulation over time. And it is a theory that it does involve really moment by moment, right? Case formulation in EFT is always done moment by moment, and we don't do it like, it's not in advance, it's not assessment driven. And it's not
process driven, right?
It's not like we plan the treatment, it's process driven, it's moment by moment, right? And we are listening for, so let me keep going here. We are listening for, okay.
Groovy slides.
I think, okay, so thinking about case formulation is a series of questions that we ask ourselves from moment to moment. The answers in turn inform our decision-making process and determine what we do next. And what we're all on about, and Les mentioned this, and I think Alberta, I'm sure you're going to talk about it too. We're all on about accessing the core pain, right? Why? Because,
that's like yeah.
Because it's like we have this saying in EFT, right? You have to feel it to heal it. So you have to, it's important that this core pain, the idea is everybody has a chronic enduring pain, suffering that we don't always tap into, but we all can tap into, and that we all kind of live through. And so we want to try to access that, because ultimately we're trying to deepen it and transform it through the process of therapy. So then it becomes a question of case formulation. How do you do it? And you do it, and the answer, of course, is you do it in a moment by moment way. And we're asking, as we're listening to people, we're asking certain questions about, about the emotion. So we're asking things like, is the client internally feeling it? Do they feel it inside? Or is it very externally focused, talking about the emotion? Is the emotion being productively processed? That's a really big thing. And that's something that Les and other EFT researchers have developed as an actual scale that measures the degree of emotional productivity and looks at that. And so we train our therapists, when we do trainings, we also train them to be able to kind of assess whether an emotion is being productively processed in the moment. We ask, is the emotion primary? Whether it be maladaptive or adaptive, we want to be focusing on primary emotions, right? So there's a typology of emotion that we've developed, but secondary emotion is kind of covering or sitting on top of primary emotion, remember? So it's really, the question is like, is the emotion is it primary? Is the emotion that we're talking about in therapy, that we're feeling in therapy, is that a primary emotion? And then of course, is there a marker? So EFT is marker driven, and markers indicate that we can move into what we call tasks that are generally aimed at emotional awareness, emotional deepening, emotional reprocessing, and emotional transformation, right? So that's, again, a moment by moment process. And so how do we do this? So at a micro level, it is more moment by moment level, we're intending to tone, vocal tone, bodily expression, facial configuration, posture, all of these things. And I mean, I say posture when we can see them, because now we're doing everything online, and it's harder to see. It's harder we don't have as many cues to be able to go off of, right? And we have to use our imaginations, perhaps even a little bit more. But yeah, we're attending in this moment by moment way, and we're attuning ourselves and sensing into what the client is feeling, and then attending to what we feel inside.
Can I just interrupt you, Rhonda? So
yeah, please.
Saying is, we're not actually talking about this or conceptualizing this. We're actually perceiving these things, right?
Right. I mean, I think there's an element of thinking.
Sure.
And, especially when you're doing the marker. I mean, I think I do it so automatically that it doesn't feel like it. But I mean, when you're listening for markers and you're trying to figure out which way am I going to go in the session, how am I going to direct this process, right? Like, or as he said, how am I going to guide, as Les said, how am I going to guide this process? I mean, there's sometimes a process of standing back. And when I'm working with couples too, right? It's like when I'm going to, well, what's the cycle and who's doing what, and trying to configure that, right? So there's a thinking process, but I mean, primarily we really give primacy to this feeling and this sensing. I think sensing is a huge thing that we do. And we put a big emphasis, and when we train our students, we put a big emphasis on sensing what the client is feeling. So yeah, and I mean, I realized what?
I'm always telling therapists to perceive the client.
Right.
Attention to the client, to look and to see and to hear and to perceive that where the client is.
Right. And so, yeah, I mean, so when I made the slide, I realized I didn't even put content on here, that we actually do listen to content, but it's sort of like content kind of falls into the background, right? And
I'm going to stop you right there, because there's a couple of questions here that I thought perhaps you want to answer, Rhonda. One of them is, speak to the balance between actively listening and searching for markers and attuning to clients' inner worlds being present. I sometimes feel as though listening for markers, what does he say here? Competes with my optimal presence and responsiveness. So it's somehow there's a balance between perceiving a marker and also being able to stay in the present moment. Can you speak to that?
Yeah.
But you see, I think if I'm going to come in and answer that,
yeah, go ahead.
I think that's making a false, and this pervades the issue of leading and following. It makes a false dichotomy between listening for markers and being present. I mean, when I'm hearing a marker, it's because I'm present.
Right.
I don't think they distinct. And even, when people say
they don't compete.
Pardon?
They don't compete.
Right. And even when people say you do something like put people in chairs, I'm fully present. And it's a way of being present. It's just that it may be slightly more structured, but it's still flowing.
Right.
When you learn it, you learn like the notes, but when you're playing it, you're fully present. When you play the symphony, you are present.
But I guess that's what I was thinking is when I'm training students, right, and they've never heard of a marker, or I think there is a more, procedural sort of automatic, like it's not so automatic for them. And so they maybe do have to step back a little bit more. And there's always like, it's a good analogy to compare it to learning a piece of music, because when you're learning to play music, you actually first learn the notes, and you first learn, you know, how to read the music, and you learn, and then you try to play a piece and it sounds all clunky, right? But then once you get good at it, it flows, and then it just like, you know, Bach, just so I think that,
so less is
but
more of a,
for me, I agree. I'm also feel extremely present when I'm doing but I think at the beginning, maybe people don't feel it. It takes time to develop that presence. But I'll still say,
I talk about these markers sometimes when I'm training therapists. I say, like, you become a predator for a marker. You actually to get a hunting image of a marker. And, oh, there it is. There's the self-criticism, or, oh, there's the unfinished business. So it's like you're perceiving it there.
Yeah.
And so you don't have to worry about it. Actually, I agree with Les that you don't have to worry about thinking about the marker, because you hear it. It's there in the room. So
but when it becomes more automatic, it just hits us. For us, it feels like it jumps out like figure background, and it seems so clear. But I think like you first have to train that. And then it just starts, right? But I mean, if you ever had to, like, I also say to my students, if you ever have to choose between like presence or thinking, go with presence, right? Like because it's much more important.
Yeah. The other question here is that I didn't know that Dr. Greenberg had also been trained in dynamic therapy. I'm curious how Dr. Greenberg's psychodynamic training was integrated into EFT. There's a question for you, Les.
Sorry, that's misleading. I wasn't really.
I didn't know that you had been trained in psychodynamic therapy. So
right.
I was curious how your psychodynamic training was integrated into EFT.
Yeah, but what I'm saying is that saying that I wasn't trained in psychodynamic, but I did go to Langley Porter for a year, where Marty Horowitz was, and I was sort of learning about what he did. But I studied. Maurice Eagle was one of my teachers, and then I co-taught the psychodynamic course. I read a lot of psychodynamic. But always it was like, what do you do? What are the interventions? And then, Lubowski and Strupp tried to specify a bit more what was done. So I was steeped in reading and understanding, and also.
And the SASB stuff was also part of it, was it? No?
The which?
Did you do the SASB? Lorna Benjamin?
That too, yeah. But so from a research perspective, I was seeing a lot of psychodynamic material. But certainly, when I had my first child, when my wife was pregnant, she and I were both in Maurice Eagle's object relations class. And that probably ruined our child, right? Because we were committed as over attentive parents and so on. So, I've always read and sort of understood, but it wasn't a theory of practice as much as a theory of functioning that was very interesting. So that's my sort of psychodynamic absorption.
So another question here from Renee is that, can you explain more about how you know if an emotion is productively processed? How can you tell that an emotion is being productively processed, Rhonda or Les? What are you paying attention to? Obviously what Rhonda's been telling you is part of that.
Yeah. I'll take a stab at that, and Rhonda maybe talk more personally about it. But the scale has these 6 or 7 features, right? Which is attending, symbolizing, congruent expression, accepting. And accepting is really important, because we can allow and feel an emotion, symbolize it, but then not accept it and say it's bad or it's not good. And then it's being an agent of the emotion rather than a victim of the emotion. So I'm active, I am this, rather than it happens to me. And then the emotion needs to be within the zone of tolerance, regulated sufficiently. And most importantly, probably, it needs to be being differentiated, which means it's over time, it's developing. You're not stuck in the emotion. So these are the sort of features that we actually have formalized in a measure. But, maybe Rhonda, you want to talk more from a gut level
Sure.
or something.
No, I mean, well, that's what I meant by productive emotion. But I guess, yeah, like maybe the question might be like, how are you doing that? And I mean, I think that it does involve tuning into your own experience, and just checking in terms of how this fits you, whether it sort of kind of makes sense. I mean, there is a kind of process of like, well, does this make sense? Like if somebody's been violated and they're not angry, then there's something that jumps out at us, I think. Like
And there's
that.
also some, if I can jump in, there's something about, where the client has come from. So you contrast it to where it's come from and you see where it's going moment by moment. So is the next moment a step forward in deepening the emotion, getting more differentiated? Then it's productive processing.
Right.
So there's also this over time perspective, which we don't capture in the measure itself. But as a clinician, those are really important. Is it fresh, new, novel, developing, expanding? Then it's productive.
And I think at a global level, actually, there's this, as soon as I start listening to somebody, like there's this external, internal, right, that I brought up before, of like, are they talking about it? Are they focused outside of themselves? Are their eyes turned inward? Are they looking inside of themselves? And so there's just this kind of global assessment of external versus internal, and we're always trying to go for, right, the internal. Like, I mean, sometimes there's, sometimes they automatically step, once you've shifted emotion, once you've processed it, then I think there's an automatic stepping out and looking at it, and because people need to then integrate it into their narrative. But I think that overall there's this global assessment of internal versus external.
There's also, there's a question actually that's quite interesting here from someone. She says, would the panelists be able to comment on the COVID-19 issue, the fact that we're doing more online stuff and how that's affected our EFT practice? So do you think that having online videos have limited or somehow impacted your ability to work emotionally with people?
So,
Well, I was...
Or train people?
I at first thought this is going to be terrible. How can you be present when you're not there? And, all the nonverbal cues. But I've been pleasantly surprised. And in fact, if you have good video quality, sometimes I feel I'm more present because I can see the face very clearly. I think there's also a strange phenomenon of reduction of anxiety by the distance created. It's been known that in forming relationships, people form relationships a lot quicker virtually because they disclose more, because there's not the threat of the other person actually being there. And so there's something about a different kind of closeness that can develop, especially when you see that face and you kind of don't have the environment around.
Yeah, I would agree.
About it.
Because when I do the trainings, even, I'm actually quite, like I just finished a training in Switzerland, and I found that the women there who were doing a time travel, self-soothing thing they were all tearing up and very moved and verklempt about, the issue and stuff. So I thought, well, there you go. And I could see, there was no question that I had to spend more time looking at the face, looking at the eyes, and I didn't have access to the body that I would before. But there's ways you can do that. You can actually help people set up in advance, do chairs on both sides, and do that kind of stuff as well.
So it really is possible to do it.
It is possible.
There's something missing too, but it's important to say it's sort of been surprisingly.
Yeah, for me, like I also, I'm agreeing with both of you. And I really, if you'd taken me back a year ago and told me I would be doing this, I would have said this wasn't possible. And so it's been amazing, right? But at the same time, I do feel like there are moments, right? Overall, I agree with you, but there are moments where like the sensing thing sometimes is a little bit hard, because I think it's hard to sense into what people are feeling. So I rely more on the verbal, like for them to tell me what's happening rather than the sensing. And then, yeah, I mean, I think that's the main thing. There's been times where I feel like if a client's like in a lot of emotional pain, and they're just say
Hard to
crying and
be
crying,
with them.
and I really want to express my my empathy. It's like it's somehow like I've had that feeling of I wish I could just reach through the screen and put my arms around, you know, like, not that I would necessarily do that in person, but just there's something that's missing. And I just, so sometimes I feel like I just have to verbalize what I would already just be able to do with my body. So I think you have to remember to verbalize what you might be feeling, because it's not coming across as strongly.
Yeah, I think that's a very good point, Rhonda. This whole issue of having to say more is a big deal, right?
Yeah.
Say more. You have to put more in language than you might normally be able to do non-verbally in a space.
Yeah,
right.
That's a good point. Mm-hmm.
Yeah.
The other last question was, there was someone who asked a question about needing a differential between interaction and interpersonal. They couldn't seem to make it that distinction. Do you have an answer for that, Rhonda?
I mean, the biggest thing is that the interpersonal there that I'm referring to is between therapist and client, and the interactional is between the two partners.
Clients.
Yeah.
Like a couple.
And so because there's an interaction, or there's already an ongoing interaction there that we're tapping into, but then we're trying to move still from secondary to primary emotion. But first we have to understand what the secondary emotions are, what the primary, right? And then we're moving in to try to shift the interaction. So
well, I think I would say the important thing is, although there could be ruptures in the therapeutic relationship, we're not talking about ruptures. It's just by giving the empathic environment, we're helping have another feeling. Whereas in couples, you're really talking about ruptures.
You know, I think that's really interesting that you mentioned that, Les, because I think we, as experiential humanistic type people, really believe that there's no such thing as ruptures when there are. Some people hate empathy, for example. They can't stand it. It's like, don't stand so close to me. It's like they don't want to know that.
Yeah, but being empathic is understanding that you can't stand empathy. And
Yeah. No, I think that's
being too close or
distinction.
too empathic, right?
You're saying it's not only empathy in terms of understanding, it's empathy about giving the person what they need right now.
Yeah, absolutely.
And attuning to them.
Being able to watch those little micro markers that are telling you that this person doesn't like this.
Right.
Yeah.
But I mean, I make this distinction now quite strongly between empathic attunement to affect versus empathy, right? Empathic understanding. So there's more problem in empathic attunement to affect, because some people don't want you to be attuned to what they're feeling.
Exactly.
So you have to not be empathic attunement, but you have to be empathically understanding that empathic attunement to affect is going to be too intrusive.
Exactly. So I think it's really an interesting dilemma that people are going. I mean, there was a question ahead of time where someone's, what was the question? Let me see if I can find it. Can you stop sharing?
Yeah. I was just thinking, like,
How
should I
do
just finish? Why don't I finish
Yeah,
this,
you go ahead.
Alberta?
Finish this.
Yes, I actually have one more slide, and then I can stop sharing, and then we can move on, right? So, and I kind of lost where I was going, but it's this idea of, but I was just going to say this, that this moment by moment informs what I do in the next moment, right? So what happens in one moment informs what I'm going to do in the next. And then it might be any of these things. And these are just some examples of what I might do in the next moment. So it might be an empathic reflection to move from secondary to primary. It might be empathic validation to help accept and allow painful core emotion. It might be an empathic exploration to elaborate and integrate and differentiate meaning, how people differentiate meaning. It might be an empathic conjecture to deepen the emotion, or it might be an invitation for a task. And I emphasize chair tasks, but of course we have a lot of different tasks. But most of those tasks are aimed at transforming emotion. So now I can stop sharing.
I have to ask, I'm having a technical problem that maybe Oh, now you're sharing my slide again.
I know. Sorry. Okay, I'm going to get out of here.
Just close it. Use the X.
Yeah,
and
don't worry. I'm getting out.
There you
Okay,
go.
there.
I have to ask Lauren, I have a question and answer thing that I can't seem to get rid of. How do I get rid of the question and answer?
Do you want to just click on it again, maybe?
I'm clicking on it. I'm not able to get rid of it. I can't close it.
Have an X button on the top left of the pop out. Do you?
Yeah, I get that too, but it doesn't do anything.
Worst case scenario, you can always click and drag it to the away.
That doesn't work either.
Mhm.
It's frozen. I just wanted to say that there's someone asked a question ahead of time that had to do with, let me see if I can find it.
I have it right in front of me if you'd like me to ask it.
Sure, go ahead, ask the question.
So there's actually two questions here. I'll ask the first. In regards to the EFT principle of changing emotions with emotion, how can you help patients to understand and practice this?
Okay, so that was the one of the things that I was going to respond to because I do a lot of teaching. I'm a shameless teacher. So I think that there's an issue around hot teaching and psychoeducation that we've never been all that explicitly good at in EFT. We do it, but we don't do it explicitly. And I think it would be a good idea for us to do that more explicitly. People don't know that we live in emotion phobic cultures. People don't know that we're swimming upstream. You know, when you're trying to get adaptive emotion, people don't know that there are people coming down on them, that there's powers that be that assert. So there's a lot of teaching that you can do in terms of giving people information about emotion, that what emotions are comprised of, that there's many components to an emotional experience. The typology that Les talks about, I think that's really important. The relationship between the typology and needs. I think secondary emotions have to do with needing to regulate. Primary maladaptive emotions have to do with unmet needs in the past. Adaptive emotion has more to do with universal needs in the present. So these are the kinds of things that people have to know more about. And you can teach people how to, you can give people homework. You can give people access to information. You can give them lots of handouts and stuff that we've got. That I think that's one important way that you can teach people how to practice being more emotional. I think that's one.
Yeah, so let me just, this is bringing me back to the beginning of SEPI. You know, one of the things that we talked about as a model of integration was you can integrate things from different traditions, provided the relational stance
Exactly.
compatible. And so at that time, RET, rational emotive therapy, was saying you can't really integrate rational emotive things into client-centered things because there's such a different relational stance. But then as we developed following plus leading, right? But the problem is that if you teach a lot, you change your relational stance. So how do you combine teaching with a non-expert position?
Exactly. That's a very, very important and good question to ask.
Right. But you know, I think the fallacy, I used to use this example that I'm not just one thing in a real relationship. So like with my late wife, I'm not just following, I'm not just advice giving, I'm not just confronting, I mix and match everything in a real relationship. So somehow we can mix some teaching with some empathy, with some guiding, but it's
about readiness.
Yeah, and it's got to do with an overall attitude that you're conveying. So, I mean, I can teach, but I've got to also convey that I'm not an expert on what your experience is. But these are kind of things to consider. So, I mean, it's something about the overall relational stance that's so important.
Exactly. Not being a school marm, not being authoritative, you know, always checking to make sure that someone's emitting a marker, that they're ready to learn something in particular. Oh, now makes sense. I think what you're doing is X. Do you agree? This total conflict, this total relationship stance is a really important part of it all.
Yeah.
Right. And I think this is coming back to relational attunement as well, right? So if I'm like lecturing on and and you can see the eyes glazing over and they're not processing, they're not thinking about it, right? Then I've lost them. So that's when I have to go back to the relationship and attend to the relationship. So, but yeah, I mean, we do a lot of teaching, but I think, Alberta, it's moment by moment, right? Like that's, I agree with everything you said, but I think that there's this emphasis on
Agree.
moment by moment teach, like you said, hot teaching.
Hot
Maybe you want
teaching.
to say something about that.
That someone's emitting a marker, that they're ready and that they want to know something.
Yeah.
There's different things that I say to people. Like I have a client right now who does a lot of drinking, and he uses drinking to get away from feeling. It's like he uses drinking to escape. So I would say to things like, oh, there it is again. You know, you're allergic to feeling. You don't want to feel. So let's do something. So it's all very matter of fact. I also do a lot of another question had to do with shame. And someone was asking.
Well, Alberta, just let me stay with, because I think you said something really important, illuminating for me. You know, when the feminist movement started in feminist therapy, it was an awareness raising therapy.
Right.
Actually, it's like an emotion awareness raising.
It is,
that
totally.
Culture has suppressed emotion. Gender roles have, culture and so on. So that actually educating about
it's very important.
Is very important.
People have to know that they're swimming upstream, that if you're a woman, you're not supposed to be mad. If you're a man, you can be mad. And that these are real forces in the culture that you're having to struggle against.
And recently, I can't quite remember the phrase, but in Black Lives Matter, I mean, to be angry as a Black person is very dangerous, right? So that was something I didn't sort of fully understand. But
there's that beautiful tape about the young Black cancer patient in Rogers, and he was saying basically, I don't want to be mad. I don't want to be the angry Black man.
Right.
Yeah. I mean, so to be angry, you're immediately labeled.
Means you're hostile and violent.
Right. So, I mean, all this education around.
So that's an important piece that a lot of people don't know enough about.
Right.
And it's something we haven't emphasized, but I think you're right to say.
Or written about, right? Because we've also gone and trained EFT therapists all over the world, right? And, Shigeru is here, for example, like in Japan, right? I mean, we learn very much about the culture that we're working with and how their relationship to emotion, right? So when I went to Japan, I began to understand, I think I still could understand a lot more about shame, right? And the many layers of shame and what it really meant to be ashamed. And I mean, I never really understood instrumental shame as well as I did once I went to Japan, how it functions. So I think that understanding, we bring that into the therapy, but we learn first, when we don't just like impose this, like, oh yeah, in your culture, this and that. It's more about learning from them. And then we're integrating what we understand about emotion with, that culture, but not imposing as much as learning about it, right?
Let me just say that I'm going to leave it up to you, Lauren, to do, because I've got a completely frozen screen in terms of the question and answers. I can't seem to find anything. And I noticed that there's more questions, but I'm frozen for some reason.
Absolutely, I'm good to go. So we have one here. How might you use EFT principles in family therapy or with more than 2 clients?
Yeah, I mean, it's a broad-ranging question, so it's hard to answer.
Yeah, it's very hard.
But I mean, the EFT approach that's developed out of eating disorders and interfamily is actually to try to break people up into dyads and do a lot of dyadic work, between different people in the family. I mean, I was trained and ran a family therapy team for 5 years, but I have not focused on really emotion in families. But people like Guy Diamond, the 2 Diamonds, have an attachment-based family therapy in which they try to get people to talk to each other from an emotional perspective.
It's very interesting. I don't know if you've done, this is a psychodynamic Bowenian therapy. He's the Bowen guy is the guy who said that people weren't differentiated enough. So in other words, when we're doing chair work, we're often trying to differentiate chairs. We're trying to get the feeling that belongs to each chair in the chair. So I'm wondering if you actually, I mean, I think that's one way that I personally will have a relationship with one person inside the family, and they'll have a relationship with another person inside the family, like a couple. I mean, I don't do family therapy, but in couples, for example. And so they witness, I'm a partner of one person, then I might switch and I'm a partner to another person. And so they get to witness something vicariously that I would do normally.
Right.
I don't know if that makes any sense to you.
Right. And also, I mean, I think the concept of negative interactional cycles, right? I mean, that's coming from systemic family literature, thinking, and we still apply that when we're, I mean, similar, we use that with couples and we use it with families. And so I think that there's, you know, emotion-focused family therapy has certainly really developed and understood that there's a strong emotion coaching component in emotion-focused family therapy, because there's been that understanding that we have to, you know, help caregivers and help parents to validate that. It's hard. I mean, everybody sort of agrees, oh yeah, validation is so important, but in actuality, parents will unwittingly, unknowingly invalidate their children. So in some ways, there is a coaching the parent or the caregiver to be able to validate the child. And so this comes back to what you were saying too about emotion education, Alberta, right? Like there's an element of that that's been integrated into the emotion-focused family therapy.
But Gary,
I will tell people, for example, in a family, I'll say, this is what's going to happen. This is like we know over time that if you're going to stop reinforcing your son, for example, for doing something, that he's going to probably emit what's called a behavioral burst. He'll do it more first. So you're going to have to be able to tolerate that. That's going to be a task for you, the tolerating part, before you get to the change part, the transformation part. So that's the part of the psychoeducation I often give of a particular person inside a family. I usually do that in individual therapy when a person's got a complaint about a family member.
What were you going to say, lads?
I think.
Yeah, he looks like he's thinking.
No, let's move on, I think, because it's a complicated.
Go for it, yeah.
Answer.
But I mean, there is still like this, ultimately EFT is grounded in the humanistic experiential tradition. And there was like Virginia Satir came before, and this idea of speaking from the heart. And there's like, you know, when I was showing those slides of these two hearts, I mean, I think that that's something that we're trying to promote, whether it be in families or couples and it just sounds very simple, but it's actually not so easy to get there. So that's basically though what we're on about, I think, is trying to facilitate that.
And in that way, I would say everything's interpersonal, because it's interpersonal inside a person, or what we call intrapersonal. It's like a conversation or a dialogue inside a person, a dialogue between a person and an unfinished business other, a targeted other, or a dialogue between two people inside the room together. And we're always trying to get someone to soften the hard part, the hard one, try to get them to open.
But you know, given that we are empirically based approach, we really haven't studied doing whole family therapy. So,
no,
you know, these are speculative kind of.
Yeah.
We've only done the EFT for family. The Marissa I forget her last name. I can never pronounce her last name right.
Maurice Bro.
Yeah, Maurice.
Maurice, yeah, but I mean, there are
a lot of vicariousness.
There are people who've done things, but a lot of it is more focused on dyads, not having the whole family together in the
Exactly.
room.
Yeah, that's true.
There's a lot of complexity there that.
Yeah, you might have a therapist playing child, or you might have a whatever. So it's a complicated, we haven't done a lot of research on that, for sure.
So can we move on?
Question, Lauren?
Mm-hmm.
Next question coming in from Portugal. What in facilitating moment by moment state change could be or is most important in leading towards trait change, like in personality?
That's tough.
You say that again?
Sure. What in facilitating or in focusing on moment by moment state change is the most important in leading to trait change or like in a personality change?
Personality.
Well, the thing that comes to mind, I mean, that's a complicated question. And
Yeah, exactly.
But I think one of the things is 2 steps forward, 1 step backwards is part of a moment by moment. So I think repetition, it's not like a single thing where you move forward and then you get ultimate change. So it's going to be 2 steps forward, 1 step backwards, and then 2 steps forward and 1 step backwards, and slowly by repetition over time and repeated experience, you will move towards trait change.
That's a good answer. I like that.
Okay.
And the repetition is important.
Alberta, did you want to talk a bit about psychoed?
Well, I just think that, when you're helping someone change or transform, there's different levels of transformation. So I think it's really important sometimes, and this fits also with the question about shame, that you have the right relationship and you're very nonplussed by the emotional BS that's going on inside of the room. It's like no big, I would say. It's like, emotion is like, so what? Like, so you're a person and things happen. So we have, for example, I had a girl who was in our borderline clinic at CAMH, and I had a question. She was basically calling me over and over again, telling me I'm not coming. You can talk to me whatever you want. I'm not going to show up. I'm never coming back, whatever. So I kind of called her when she wasn't there on purpose. I said, listen, I'm calling you on purpose because I know you're not there. So I don't want to offend you, by forcing myself on you. I just want you to know that when you started, I said that I would be the champion of the part of you that wanted to stay in therapy. So that's why I'm calling you when you're not home. So I'm going to call you at 7 o'clock tonight, and you can answer or you don't have to answer. No problem. That's your choice. And I get it. You're very angry. You don't want me to force myself on you, and I understand that. And so what was so interesting is when I called at 7 o'clock, she answers the phone and she immediately apologizes for being so angry with me. I said, it was appropriate. You were assertively angry. I was trying to get you into treatment. You didn't want to go into treatment. You felt intruded on by me, and I was intruding on you. That was all true. But we do know at the same time, I said, we know emotionally that you can actually become your mind changes when you have an emotional state. So I said, do you still want to leave? And she says, no, I don't want to leave. I said, okay, I'll see you next Wednesday. And that was it. Bye. That was all there was to it. So the issue was somehow I was able to respectfully be pushy.
Right. But I guess the other thing that strikes me in the story, Albert, it's a good story, is how validating you were, right? Like you were trying to understand always, right, where she was coming from, and you were validating. Like of course you were angry, you were intruded, right? You were always trying to understand, you were always trying to validate and reframe what was actually happening between you in terms of what was happening within her and maybe what had happened to her in her life and around being intruded upon. So there's always this kind of validation, understanding. And I guess maybe sometimes people think that that's a more passive state, but it's actually a very active kind of state. And that's what you're saying too. Like you had to be very active in that way.
Yeah, and it's a fundamental way of viewing people, which is seeing that people are always doing the best they can to survive and thrive, and not seeing them as negative, as sick, as something's wrong. I mean, they are doing the best they can, right? And also to see that they may be suffering, but that's so fundamental and so foundational, right? And that influences the way your stance and the way you approach people.
Yeah, absolutely. Yeah.
And I think some people really are, depending on like Rhonda, you were talking about how in humanistic therapy, we don't like to pathologize people. We don't like to give them diagnoses. But I think there's a process that we pay attention to when people are actually in our rooms together. We know if they've been neglected or they've been criticized or whatever, and we can see that kind of thing. And I basically only I give people help when they've been neglected, they've been very self-reliant and they need help. If they've been more invalidated and criticized, I'm more empathic and I'm more validating. So I kind of use
Right,
that.
because you understand it and where it's coming from in them, right? You don't feel it personal.
Exactly.
Mm-hmm. Mm-hmm.
Go ahead. Do you want to ask another question, Lauren?
Absolutely. So this one's coming in from London, England. Does EFT ever look at the relationship between emotional expression and physical complaints?
Like somatic kind of.
Yeah. I
Like
mean,
Saksa.
clearly it's a general part of working with emotion. I mean, there's been no research or no specific study, but, you know, and this is also very interesting cross-culturally, because Asian cultures, there's certainly research that they somatize more.
More, yeah.
And that, in fact, there's even one study, I happen to have been doing a review of it, that in Korea, Korean therapists or people who responded to the somatization were perceived as more empathic than people who responded to feelings.
Yeah.
Right.
Like, you mean if they complain about how they feel, like their knee hurts or something?
Yeah, or my heart, you know, there's a classic
Yeah.
Korean thing of my heart is burning. I can't remember the exact words.
I remember, to be honest, I remember one time when I was in Hong Kong and there was a girl who was like all shaking. She was doing chair work and she became all shaky. So I just got her up out of the chairs and we were walking around and I was trying to get her nervous system to interfere with her shakiness, whatever. And she found that extremely helpful.
So, I mean, there's certainly, but you, just to finish that point, that if, you know, if my heart is burning, I've got this burning in my heart. If I say, so you're really angry at your husband, it's not nearly as empathic as to say, so you have this physical pain in your heart. It's really hard, you know. So, but yeah, I mean, it does seem still that moving from physical sensation to emotions ultimately is important, and that there's clearly a strong connection between physical and emotion.
And I use psychoed there, for example. That's an example of someone who, it's your wheelhouse to somehow, my guess would be, I always try to make it very my personal theory of you or whatever. So this is not about the ultimate truth. This is about my guess. My guess is that this is your wheelhouse. This is what happens to you. You know, when you have a feeling or you have a long, strong emotion, that somehow it ends up in your kneecap or your shoulder or your lungs or whatever it might be.
Yeah. And also, I guess there's meaning, right? I mean, like, so that's what we're kind of, that's what I'm hearing us say. And meaning is a big, important piece of how we work as well. And we work with meaning. So it's like, what's the meaning of the burning in your heart, right? And so somehow when you reflect that with people, you're reflecting that back to them, right? I mean, but of course you're doing it more congruently if you say, you know, there's just this burning, and metaphorically, right? I mean, we also work a lot with metaphor, but it's really like, what is the meaning that's being expressed by the physical symptoms?
The burning heart, yeah.
And focusing, which is also, you know, experiential focusing and Zhenlin, right? Like that's a part that's been integrated into EFT. And that's a lot about connecting the bodily felt experience and the meaning and the symbol of what it's expressing. So I think that there's that as well.
But just
that's an important awareness.
The meaning part, you know, something we haven't said, but I like talking now about bringing cognition to emotion.
Exactly.
And it's sort of discussing the relationship, but it's sort of like making sense of our emotions.
Exactly.
Meaning, and that's a very important part. But, you know, it's the flip side of that meaning creates emotion. It's really
it's not, exactly.
making meaning of emotion and bringing cognition to emotion is very important. So we don't only emphasize emotion, we also emphasize making meaning of emotion.
Yeah.
And that focusing is an important intervention in that way. I find it very interesting. I think people who actually are able to put words on their physical experiences find it very helpful somehow, if they can do that.
Yes.
Something that men often do. It's very private. It can be extremely helpful.
Yeah, because I talk about that in therapy. I mean, you brought up the men thing. So the gender piece, which we haven't talked about very much. But I mean, I guess this is like we find, or I find anyway, that men are quite responsive to the question of what does it feel like in your body, right? They seem to.
Yeah.
I mean, I know these are generalizations, but somehow it's just very interesting that sometimes if they're sort of more, they have more difficulty expressing their emotions, then if you ask them what does it feel like inside their body, it's somehow it's easier for them to answer that and to go there.
It is interesting. Go ahead, Lauren.
All right, I think this one's coming in from Albany, New York. Can you speak to chair tasks and other tasks that are used in EFT and their function?
Oh, there's a lot there. There's
Yeah.
huge answer.
Well, I think they're used in they serve multiple functions, but they emphasize expression, not just awareness. And so it's one thing for me.
And contact.
Yeah, and contact. So there's something additive about chair work. I mean, it's embodying what I'm talking about, but expressing and saying, I hate you is to your imagined other is different to saying to the therapist, I hate my mother, right?
My mother.
Or I love my mother, right?
Exactly.
So contact creates experience. Awareness, and we have research that shows that, you know, when you're aware, that's not the same as when you're aroused, expressing. And they are two different elements. So chair work uses expression in addition to awareness. And it's very powerful. It's the most stimulating. So it's both chair work and imagery. They somehow stimulate affective arousal in a way that...
I think what you're saying, Les, is really important. This whole issue of chairs being used in a way that creates connection between the two parts, whatever those parts might be, within yourself or between you and an unfinished business other or between you and a partner, whatever it might be. It's about how I actually create connection. It's like not just a sequence where I can say to my therapist, I hate my mother or I hate my father, or something happens and something else happens or whatever. You actually get the stimulus and you get a reaction to that stimulus. So that connection is a really important one. I think that's what chair work really, really helps and why it accelerates the process so well. Go ahead, Lauren.
All right, so we have two related questions, so I'll sort of try to combine them. Can EFT be used with a wide range of clinical problems such as personality disorders, psychosis, or is it more useful / validated with specific problems?
Alberta, you want to, I mean, clearly it was developed with affective disorders and then developed into eating disorders. I mean, Alberta has worked with it with personality disorders, but it wasn't developed initially with personality disorders. So it needs some adaptation.
I think there's an interesting issue here around what we need to do to actually formulate particular interventions that would make it more useful for particular populations. Like, I think you're right that somehow EFT as the usual, treatment as usual model was developed around depression and anxiety and that kind of stuff. So it's about more around arousal of emotion and making meaning of it and transforming it. And people don't see it often as something that can also structure. And I think that that's something that we're moving into more and more and more, is to actually understand that EFT can be used to structure experience, not just activate it.
Right.
And also it's been applied to trauma, especially complex trauma. And there's slight modifications. But I mean, what I like to say, although I haven't worked a lot with severe borderlines at all, is fundamentally in human functioning, emotion is the driving force. So eventually you've got to get to emotion somehow and deal with it. But with more dysregulated people, there's going to have to be a lot more structure and less
regulation,
arousal and more regulation and so on.
And I think, you know, EFT has moved, as the field has moved more towards transdiagnostic theory, that EFT has moved in that direction as well. And we talk about what is the, you know, speaking about case formulation, is we talk about what's the core emotion scheme, what's the painful core emotion scheme. And whether, you know, it be different kinds of clinical disorders that people are asking about, depression, anxiety, eating disorders, trauma, right? Even addictions, right? That we're still understanding what the core emotion scheme is. And then there's like layers on top that we build in terms of what we might have to, like if it was addictions, for example, then they may need some sort of additional piece to work on the addiction itself, but then there's still a core emotional process underneath that we're going to be thinking about and working with and trying to transform. And so I think it's, you know, Alberta, you've done a lot more and developed a theory, a lot more for personality disorders. And so that's really interesting. But I mean, I guess like with psychotic, we haven't, and we're, you know, it's not,
Yeah, well,
we haven't developed.
I mean, Robert Elliott is interested in applications of
Psychosis?
Yeah, and
Really?
this contact, going to very fundamental points of contact with so-called reality, you know. But yeah, I mean, I think the big issue is emotional arousal, right? I mean, the EFT clearly is saying we want to activate emotion and then we want to reflect on it to make sense of it. So it's the activation. And, you know, when I started, and I mean, in psychiatry, when I first went to a psychiatric internship, I mean, that was in the crazy 60s and 70s. I mean, there was a lot of activation of emotion, and you know, the establishment was very scared of that. I'm very like, that's not good, right? So there's this big issue. Can it be dysregulating, too dysregulating, versus can it be helpful, right? And hopefully we're offering a more differentiated perspective, is what emotion can be helpful at what point, to what degree of arousal, for what purpose, done by whom, and what kind of relation. You know, it's not just, is emotion arousal good?
I think that's really important. What you just said is really important, Les. And I think that I still read a lot of literature out there where people are not paying close enough attention to the typology of emotions that you've identified. The idea that someone could actually be, I mean, I think what's really, really interesting is that CBT often works with the squirrely thinking that comes along with maladaptive emotional arousal. So secondary emotional arousal can also be maladaptive, but it's mostly the need is to regulate. So if I come from a culture, there's two reasons why I might have to have a secondary emotion. I can have a secondary emotion because I'm told I'm not supposed to feel this way. Like if I'm a Spanish girl or I'm a Catholic boy or whatever, I'm not allowed to feel something. I'm not allowed to cry. I'm not allowed to be angry or whatever it might be. I'm not allowed to feel shame, whatever that might be in your culture. That's one reason. You're given rules about what you can and cannot feel. But then there's also things that you as a person can't tolerate. So I have a client right now who does a lot of drinking, and he drinks instrumentally and he rages instrumentally because he's allergic to feeling. He can't stand feeling. So as soon as he has a feeling, he's got an allergy to feeling, and he immediately starts drinking to get away from it, or he starts yelling at his wife to get her to shut down, to stop it. So this is where all of the typology is so important.
Yeah, I mean, there's this phenomenon, Janice Weston in her recent dissertation, I mean, labeled it as fear of dangerous emotions, right?
Yeah.
You know, there are all these examples of people fear that their emotions will lead them to disintegrate and that they can't cope.
Sometimes, yeah.
And then they protect themselves against the dangerous emotion. So we are approaching them with respect for that they are protecting themselves, but with an understanding that you have to go through it in order to come out.
Yeah. That's the pushy part that we do.
So you have to sort of hold the fear, but help people approach rather than avoid. So I mean, when I was young and very into meaning as the meaning of everything, and I've shifted to say it's the feeling before the meaning, but I used to think saying avoidance of emotion was oversimplifying about what distress is about. But I mean, I've really come to feel that avoidance of emotion, but I don't like the term avoidance. I like the notion of protecting against emotion, is actually fundamental to dysfunction, to psychological dysfunction. And
Some
it's
people are very allergic to feeling. They don't want to feel. And we live in a culture that's emotion phobic.
But also, like, I guess protecting
Yeah.
against overwhelmed emotion, right? Like, it's not the emotion itself. It has to do with the fear of being overwhelmed by it or losing control or.
Right. And so it's not that I'm avoiding emotion because emotion is painful, which I call the ouch factor. I'm actually protecting myself against emotion as a coping skill for
Right.
fear that if I feel the emotion, I won't be able to cope.
To cope.
Right.
Exactly.
I will
Right.
disintegrate and I will fall apart. So what I'm actually doing is I'm not saying, oh, the emotion is too painful. I'm saying the emotion will lead me to not.
Will lead me to be dysfunctional.
Yeah, I'll disintegrate, but it's not the
I won't be able
pain
to
of the
cope.
disintegration. So a simple learning theory kind of notion of avoidance and exposure is not what we are talking about, right?
Right.
So that's why when I do hot teaching, for example, I will tell a client, I said, you know, it's one thing to know what I'm feeling. And it's another thing whether I want to express it or not. It's a whole other issue.
Yeah.
You know, it's not my job to tell you what to do, or how to be, what to feel, what not to feel. But it is my job to tell you the cost of what you're doing or what might be happening. That's my job. So I describe a lot.
Okay, but yeah, so just like what you were saying, I just wanted you to finish that thing about it's not exposure, and I mean because it's not just exposure, right? It's activating the emotion, it's feeling the emotion, but then it's also about that there's another emotion, and that emotion we can bring in to soothe that.
So I mean,
old emotion.
exposure is diminution or reduction of problematic emotion that's sort of too dysregulated or too dysfunctional, right? But we're saying that's symptomatic predominantly, and that underneath that is the generating emotion. And then we're going to work on that underlying emotion to change it by bringing in another emotion. So we're not reducing. I mean, the simple notion is reducing, right? But
not
I mean,
getting rid of anything.
We're not replacing either.
Right, and we're not replacing. But I mean, in modern learning,
juxtaposing.
Modern learning theory, they're talking about new learnings, which are a little bit like a new emotion to change an old emotion.
Right.
But it's not reduction in arousal. I mean, this is a more complicated.
It's really interesting, though, because one thing I've learned over time in working with people who have personality disorders is that they often are very highly aroused before they even come to the session because they're so upset about things. And I discovered that through doing chair work, sometimes there's the reaction of the person in the chair work is to feel really tired and to feel calmed and to have their parasympathetic nervous system activated after they're doing chair work. So it's like they'll call me or they'll text me after the session. They'll say, thank you very much. I'm tired. I'm going to go home and go to sleep. And they have a little nap. I say, this is a really good sign. This is a marker that somehow.
So what do you say? I missed the first part. What leads to that calming?
The unfinished business. Somehow they're doing either
the expression.
You mean it's
somehow
the arousal then leads
the softening. Yeah, they're no longer aroused in the sympathetic nervous system, flight part of their nervous system. They have this softening and they've really reached some sort of attachment-based reaction that has allowed themselves to transform their state.
Yeah, and I think the thing is that people who are afraid of emotions, and many therapists are afraid of emotions, if you communicate or meta-communicate your fear to the client of their emotion, the client gets very distressed and is afraid. So there's something about being able to sit with and help people with their arousal, accept it, validate it, understand it, that helps it to not be
very, very helpful.
Right. So this is where we come back to presence, right? That's what I was going to say. Right?
And being able to tolerate.
So your warm, empathic presence, right? And so they're with you, and then they feel them. And then you said this thing before, Les, about like this coping, like the fear ultimately that I will have this emotion and it will kill me, or I'll Like, I think there is really often this irrational fear that you could say that they'll die of the emotion, right? But it's like you're sitting there in your presence, and they're also showing it to you and revealing it to you. And that's an important part. And you're witnessing it and being with it. And then they have this experience and they go through it. And then there's another emotion that comes, and it's not so scary as they would have maybe feared it was. So I think there's something about the therapist presence that we have to also remember. We have to give ourselves credit for.
Right. And it's a particular kind of presence. I mean,
yeah,
it's the soothing.
And then being nonplussed. I think that's a really important part.
Sorry,
the therapist to be able to
Nonplussed?
not be so afraid of your own feelings or the feelings of your client. It's like no big whoop.
right. Like
We all
nothing
have
really
feelings.
ruffles us.
Yeah. And that's an incredible process to learn.
It is very difficult.
I mean, when you're a young
Yeah.
therapist and someone is weeping deeply about pain and feeling even like I can't carry on. I mean, that's not necessarily suicidal, but it's an expression. I mean, then the human tendency is to want to make it all better. And
And to fix it and to recoil.
Right, to be able to just witness and be present too is so important, right? But difficult.
And also, I think, like for me, I always tell people that it's my own therapeutic emotional experiences that have allowed me. I mean, I've always been quite comfortable with emotions, I have to say, but I think that having these experiences myself as a client and really confronting and feeling some very painful, difficult, scary emotions, and then living through it, so that if a client enters into that kind of deep, painful state, then I somehow feel they're going to be okay. And I've said this to you before, Les, and we've laughed about it, but it's like when people start to feel their emotions, I actually feel myself calm down, because I feel like, oh, okay, phew, we've got to where we need to go. We're on the right path, right? And as opposed to I start getting more anxious and panicky, right? I mean, I actually calm down, which is really funny because I told Les this one time and he told me that makes me a psychopath. But anyway.
Jokingly.
Right? Yeah, jokingly, of course. But no, but I mean, I think it's true. Like we do calm down. Or at least I do, and I think you both do. So that's what you're saying, Alberta, too.
And something you said, Rhonda, that I just wanted to comment on. I've never actually said this before. I mean, you are, and you have said you're very comfortable with emotion. I mean, as a rational engineer, and even if you listen to me talking, I'm very intellectual, I'm very conceptual, and I have never been comfortable with my emotions. They say research is me search, right?
Yeah.
I mean, I've become comfortable through training, particularly in Gestalt therapy, where, it was a part of the zeitgeist. But I mean, so as a man and as intellectual, it hasn't been easy for me to be emotional, but I've learned, right?
Yeah, that's interesting.
I mean, I'm much more comfortable now at 75
than you've ever been,
than I've ever been. And it's supposedly the older you get, the easier you are with your emotions, But so it's interesting where we come from.
Would you say there's parts of your emotional field, Les, that you're more comfortable with than others?
Say again?
I think that's an important piece for all therapists to know, is if there's parts of the emotional field that you feel more comfortable with than others.
Absolutely.
Help the client, be angry or be sad or be afraid, but you wouldn't be able to help them feel guilt or whatever it might be.
Yeah, I mean, so you have to learn that about yourself. And I was very uncomfortable with anger because anger somehow meant I was defeated or you got to me. But I was, I was a man, so I couldn't cry either. So I was, but yeah, I think learning about what you are most comfortable with and then learning how to deal with the ones you're uncomfortable with is part of the growth of being a therapist.
And on that note, I'm going to jump in and say we're out of time. Believe it or not. So we actually had a few questions that we weren't able to get to. Would the panelists be open to being reached out to via email?
Yes, sure, no problemo.
Sure.
More than happy.
You
Yeah.
may not get immediate or long answers, but
My screen's been frozen for the last half hour, so I haven't even been able to see the questions that we are not.
oh, wow. Oh.
Yeah, I had a
All
little
right.
problem too.
Thank you.
Thanks. It's been
And
really fun
Stephen McFarland to
conversation.
all panelists. Thanks, guys.
Yeah, everybody's saying
Bilkin
thanks.
to everyone. Thanks so much, all.
So it's been fun for me. I hope that everybody enjoyed listening, and I enjoyed your questions. So thanks so much. Thanks for the stimulating questions.
And so it was only through your announcement, yesterday, that I understood that the conference is going virtual.
Yes.
In June, right?
So we'll be going completely virtual and we're going to have a meeting
right.
about that in the next couple of days.
So we will meet again.
We will talk about this. I did actually also email you, Les, about mentorship as well.
Oh yeah, Alberta, I thought about that when you were talking, and I can do that if you want.
Let's not do that here now. But,
Okay.
Thank you, Samuel.
Okay.
Well, everyone who's left, please consider joining SEPI. It's a great organization with access to all these fabulous webinars, and feel free to follow us on Instagram, Twitter, and Facebook.